we're talking about wound care. Um, Wound care in podiatry. What do we do in wound care? Well, wounds. Diabetics obviously are known to have wounds on the lower extremity because of diabetic neuropathy. You don't feel what's going on at the bottom of your foot. So you step down and you develop an ulcer. Uh, Callus. Calluses are the first indication of pressure, increased pressure in the lower extremity. Your body's natural way to defend itself against pressure. So what happened is when you have this callus builds up and you're neuropathic, you don't feel the formation of pressure underneath that callus, which can break open the skin further, deeper into your foot, into the bone. And as you can see from my foot model, there's not much between the bone, the skin, and the outside. So the best way to show it, I show it to the medical students, is when you take your thumb, you put pressure on your thumb, you can see the blanching. So when diabetics or people who are insensate constantly put pressure on their toes, excessive pressure, you can get breakdown of the skin. You don't really notice that. You don't feel it. Now, for regular folks with sensation, you can feel that. You can feel pain. You can feel that callus being very painful. That's why calluses are painful. Your body's natural way of protecting itself, right? So again, if you do this exercise, you put your fingers together, you put pressure, you see the blanching. Now, the other issue that happens is when you have, let's say, poor blood circulation to the area. Poor blood circulation, we see that in age, we see that in diabetics. Sort of like you can have this kind of clot in your heart for a heart attack. You can have clots in your foot and your leg, a toe attack, foot attack. I would say you're just not getting the flow to that particular area. That could predispose you to further ulceration and not healing. Now, how do we do wound care? Well, wound care is about assessing the whole lower extremity, assessing for blood flow, assessing for pressure areas. I think this is why podiatrists are really good at this because we deal with gait patterns all the time. We deal with offloading pressure areas, and a callus is not a callus to us. Callus is an indication of excessive pressure or force, right? So we we definitely take extra care in making sure that we take away the pressure. As you can see, the knuckle of your metatarsal. I always show patients the knuckle of the metatarsal. They're actually very, very, very sharp down here, as you can see right here. So imagine walking on bare barefoot. You walk on a hard surface, and you could break down. How do we handle that in our practice? Well, number one, we offload it. Offloading meaning putting pads around there. Or the other option is a surgical option. Sometimes we could cut the knuckle, shift the bone in a certain position into where there's more fat. Obviously, there's more fat in the middle of the foot. In the arch of the middle of the foot, you see more fat here. There's very little fat down here. So what we do sometimes, we cut the bone, we shift the bone backwards, or we take that little piece of bone out so it doesn't cause an ulceration. The ulceration gets so deep into bone, when it gets into bone, it gets something called osteomyelitis. Osteomyelitis meaning bone infection. Not good to have. So, so there you have it. As far as wound care is concerned, there are many things we can do. We can debride the wound, cleaning out all the dead tissue to allow it to heal. Make sure that's enough circulation down there. We consult with a vascular specialist colleagues. There's a video of myself talking with Dr. Echeverra, one of our vascular specialists in town in Naples. Um, and then after that, we have various different options. We have activated collagen, we have activated grafts that we can use, and worst comes to worst, we could also do a skin flap or skin um, substitutes, or even a skin graft at the hospital if we have to. But we have skin substitutes in the office that we can use, meaning that they're manufactured skin substitutes that helps to mimic and have the growth factors to help you heal. Most common ones being Apligraf, Dermagraft. People have heard about it. You've probably seen advertising on health magazines, etc., direct to consumer marketing. So there's many things we can do. As podiatric surgeons, we're able to go ahead and offload the area. We could do a tendo Achilles lengthening to take away some of the pressure. But most of all, we make sure that the toes are balanced, make sure you wear proper shoe wear, and proper follow-up with the podiatrist every 6 months at least, sometimes 3 months. But if you're getting pre-ulcerative ulcers, such as calluses, may want to see you a little bit sooner. Inspect your feet every day. Make sure those calluses don't get out of hand. You have blood underneath them, that's a problem. We need to see it. So that's it for now in regards to talking about wound care. So wound care is it's a very big field in podiatry. We deal with anywhere from ulcers in the toes all the way up into the leg. And I always say, as podiatrists, we want to save as many toes on you as possible because without your feet and toes, we're out of business, right? So we go ahead, we definitely try our darnest to save what we can. But it's a multidisciplinary approach between ourselves, the vascular surgeons, and your primary care doctor to make sure your diabetes is under control, your nutrition is right, your circulation is right, and we're properly offloading you. So preventative care is very important, guys. If you do have a wound, see your podiatrist, see us. We have locations and Port Charlotte coming up and moving on up the west coast of Florida. So if you guys have anything, give us a call, 239-430-3668. Visit us on our website, naplespodiatrist.com, and look forward to seeing you soon.